corneal transplant is part of the eye, the front window of the eye, which can get affected through trauma, diseases, just age-related conditions. And traditionally, corneal transplantation requires a full thickness graft. So you remove the entire cornea and replace it with a brand new cornea. But techniques have developed over the years. And for the last decade or so, the most advanced technique is DMEK, D-M-E-K, desiccated membrane endothelial where we just use a very fine 10 microns of tissue to replace the area which isn't working.
It has been amazing. We have learned a technique that is not done routinely here in Karachi. So it was a really good experience for us. And then we got to do hands-on as well. So as a resident, that was a huge achievement.
The advantages in taking less tissue is it reduces the risk of rejection. And the evidence does show that you get quicker visual recovery and sometimes better visual outcomes. So it's very nice to have in your arsenal of surgical techniques the ability to perform all of these procedures.
By doing the simulation training, we can practice again and again, get that tactile feedback.
Now in this procedure with DMEK, we are only transplanting the endothelial layer, the fifth layer, which is very rare in Pakistan. We have a burden of disease of these particular patients in Pakistan, but they are most commonly neglected.
It's been fantastic. I mean, I'm incredibly impressed with everything that AKU has been able to put on. So, I mean, we've been lucky enough to see some of the clinics, we've seen the theatres, we've met some of the staff.
And what you see behind me now is a live wet lab. We've got live corneal tissues simulating the exact same conditions as one would have in theatre. So that mistakes can happen here and practices can happen here before the real patient. And as you can imagine, this is high stakes corneal transplantation because these donor tissues are very rare. There's a lot of scarcity involved.
So experiencing a human tissue and getting to do these steps under supervision by the experts has been a really good experience for all of us. And inshallah, once we have learned it, hopefully we'll be able to do it on a real patient someday.